Our blood is a vital fluid that carries oxygen and nutrients to every cell in our body. It also helps fight infections and heal wounds. When something goes wrong with our blood, it can impact our overall health and well-being. These problems are known as blood disorders. Blood disorders can affect any part of the blood, including red blood cells, white blood cells, platelets, and plasma. Some are inherited, meaning they are passed down from parents to their children. Others are acquired, meaning they develop during a person's lifetime. Understanding blood disorders is crucial. Recognizing the symptoms can lead to early diagnosis and treatment. This can significantly improve outcomes and quality of life for those affected. Anemia occurs when the body doesn't have enough healthy red blood cells. This condition can affect people of all ages. Red blood cells carry oxygen throughout the body, ensuring organs and tissues receive the oxygen they need. Without enough red blood cells, you may experience fatigue and weakness, impacting daily life. There are many types of anemia, each with its own causes, such as nutritional deficiencies or chronic diseases. Iron deficiency anemia, the most common type, occurs when the body doesn't have enough iron. Iron is essential for producing hemoglobin, which carries oxygen in red blood cells. Symptoms can include shortness of breath, pale skin, dizziness, and cold hands and feet. Treatment depends on the cause and may include iron supplements, dietary changes, or blood transfusions. Sickle cell disease is an inherited blood disorder that affects red blood cells. People with this disease have red blood cells that are shaped like sickles or crescent moons. These abnormally shaped cells are stiff and sticky, and they can block blood flow in small blood vessels. These blockages can cause episodes of severe pain called pain crises. They can also damage organs over time. Symptoms of sickle cell disease usually appear in early childhood and can vary in severity. There is no cure for sickle cell disease, but treatments can help manage the symptoms and prevent complications. These treatments may include pain relievers, medications to prevent infections, and blood transfusions. Hemophilia is another inherited blood disorder that affects the blood's ability to clot. Clotting is a complex process that stops bleeding when a blood vessel is injured. People with hemophilia have low levels of certain clotting factors, which are proteins that help the blood clot. As a result, people with hemophilia may bleed for a longer time than normal after an injury. They may also experience internal bleeding, even without an injury. Symptoms can range from mild to severe. Treatment for hemophilia typically involves replacing the missing clotting factors. This can be done through regular injections of clotting factor concentrates. Section 5. Leukemia, a cancer of the blood and bone marrow. Leukemia is a cancer of the blood and bone marrow. Bone marrow is the spongy tissue inside bones where blood cells are made. Leukemia starts in the bone marrow and can spread to other parts of the body. This cancer occurs when the body produces too many abnormal white blood cells. These abnormal cells don't function properly and can crowd out healthy blood cells. This can lead to infections, anemia, and easy bruising or bleeding. Symptoms of leukemia can vary depending on the type and stage of the cancer. Common symptoms include fatigue, weakness, fever, weight loss, and bone pain. Treatment for leukemia may involve chemotherapy, radiation therapy, or a bone marrow transplant. Section 6. Lymphoma, a cancer of the lymphatic system. Lymphoma is a type of cancer that primarily affects the lymphatic system, which is a crucial network of tissues and organs that help the body fight infection and maintain fluid balance. The lymphatic system includes several key components such as lymph nodes, spleen, thymus, and bone marrow, all of which play vital roles in the body's immune response. Lymphocytes, a type of white blood cell, are an essential part of this system, helping to identify and destroy harmful pathogens. Lymphoma begins in these lymphocytes and can spread to other parts of the body, including the liver, bone marrow, and spleen, making early detection crucial. There are two main types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma, each with its own unique characteristics and treatment approaches. Symptoms of lymphoma can often be similar to those of other common illnesses, making it essential to consult a healthcare professional for an accurate diagnosis. Common indicators of lymphoma include swollen lymph nodes, persistent fever, night sweats, unexplained weight loss, and chronic fatigue. Treatment for lymphoma varies depending on the type and stage of the cancer, and may include a combination of therapies. These treatments can involve chemotherapy, radiation therapy, or immunotherapy, each targeting the cancer cells in different ways to improve patient outcomes. Section 7. Thalassemia. When your body doesn't make enough hemoglobin. Thalassemia is an inherited blood disorder that affects the production of hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen. People with thalassemia don't make enough hemoglobin, which can lead to anemia. There are two main types of thalassemia: alpha thalassemia and beta thalassemia. The severity of thalassemia depends on the type and how many genes are affected. Symptoms can range from mild to severe. People with mild thalassemia may not have any symptoms. People with severe thalassemia may experience fatigue, weakness, shortness of breath, pale skin, and slow growth. Treatment for thalassemia may involve regular blood transfusions and chelation therapy to remove excess iron from the body. Section 8. Aplastic anemia, a rare and serious blood disorder. Aplastic anemia is a rare but serious blood disorder in which the body stops producing enough new blood cells. This occurs when the bone marrow is damaged and can't make enough red blood cells, white blood cells, or platelets. This deficiency can lead to fatigue, shortness of breath, increased risk of infections, and easy bruising or bleeding. The exact cause of aplastic anemia is often unknown, but it can be triggered by exposure to certain toxins, radiation, or medications. Treatment for aplastic anemia may involve medications to suppress the immune system, blood transfusions, or a bone marrow transplant. Early diagnosis and treatment are crucial for improving outcomes. Section 9. Von Willebrand disease, a common bleeding disorder. Von Willebrand disease is a common inherited bleeding disorder that affects the blood's ability to clot. It is caused by a deficiency or defect in von Willebrand factor, a protein that helps platelets stick together and form clots to stop bleeding. People with von Willebrand disease may experience frequent nosebleeds, easy bruising, prolonged bleeding from cuts or dental work, and heavy menstrual bleeding. The severity of symptoms can vary widely. Treatment for von Willebrand disease may involve medications to increase the levels of von Willebrand factor or clotting factors in the blood. These medications can help control bleeding episodes and prevent complications. Section 10. Polycythemia vera and hemochromatosis. Too much of a good thing. Some blood disorders arise from an overabundance of blood cells or minerals, which can be dangerous. Polycythemia vera is a rare blood cancer causing excessive red blood cell production, diagnosed through blood tests. This thickens the blood, slowing flow and increasing clot risks, leading to strokes or heart attacks. Symptoms include headaches, dizziness, itching, and a reddish complexion. Treatment involves regular blood withdrawals to reduce blood thickness. Hemochromatosis is a genetic disorder causing excessive iron absorption, detectable through genetic testing. Excess iron accumulates in organs, leading to severe health issues. Treatment involves regular blood removal to lower iron levels. Maintaining balanced blood composition is crucial for good health. Section 11. The importance of early diagnosis and treatment. Blood disorders, while diverse, share a common thread. Early diagnosis and treatment are crucial for improving outcomes and quality of life. Recognizing the signs and symptoms and seeking medical attention promptly can make a significant difference. Regular checkups, especially for those with a family history of blood disorders, are essential for early detection. While some blood disorders are inherited, others can be acquired, emphasizing the importance of a healthy lifestyle. This includes a balanced diet, regular exercise, and avoiding smoking and excessive alcohol consumption. By understanding blood disorders, we can take proactive steps to protect our health and manage these conditions effectively.